Hello and welcome to our third and final webinar on planning and implementing leisure and health programs. In this session we will discuss evaluating activities, documenting the activity or program, and monitoring and evaluating the individual program plans for our clients. Let's start this session by talking about monitoring leisure plans. Once a program plan is implemented, the next stage is monitoring this program plan to ensure that the plan remains effective throughout the duration. At the end of the session, the program will need to be evaluated to ensure the best possible outcomes are reached for the clients and participants of the program. Most importantly, when using program plans, we need to remember planning is performed with the people, not for the people. If we miss this point, programs may look great on paper, but we will encounter difficulties when implementing the program with clients. Monitoring and evaluating is often thought to occur at the end of a program. However, it's best to monitor often, and evaluation can occur at any step in the planning process. For example, evaluation can be used during the needs assessment stage to develop a program or to improve on an existing program. Let's now talk about the importance of having a process to assess and review leisure programs. We're going to look at the different methods that can be used to gather information and feedback on a leisure program. The first is client evaluation and feedback. Client feedback is a valuable source of information. For this reason, client feedback and evaluations are key components of the evaluation process. Another form of feedback is peer observation and review. Colleagues from your own workplace are often used as a good source of evaluating the facilitation of your program. They can provide professional feedback and guidance. You can find out how they perceive your facilitation of the program and any aspects in which you might try to improve. Another way to improve on your leisure and health program is by self-observation, self-assessment and critical reflection. Reflective practice in all areas of work are encouraged as an evaluation strategy. All the feedback you can obtain from other sources is, of course, of little use unless you have reflected and critically approached your own practice. In all cases, self-reflection and client feedback are imperative when evaluating your activity or program, so that you can streamline your processes, evaluate outcomes, goals and objectives, and provide a service that targets the clients and individuals with whom you are catering for. What's the purpose of evaluation reports? Your evaluation findings help stakeholders understand the real story. So, what you need to find out is, did you do what you said you were originally going to do? Did you do it well or to the best of your ability? And did you make a difference for the clients that were involved within the program? These are some of the things that you want to find out during the evaluation. Let's now look at some of the kinds of information that will be included in evaluation reports. A formal final evaluation report would generally be expected to include the following kinds of information: the background of a project or the activity, the context of the program, the purpose of having the evaluation completed, a list of stakeholders or audiences or clients, key evaluation questions and the information you actually want to gather, information gathering sources and techniques used for evaluation, data analysis procedures, criteria for any judgments, findings and conclusions, any recommendations, and then any supplementary materials such as appendixes. Let's now look at the importance of documentation. Documented information can include policies and procedures, care plans, progress notes and leisure and health programs, just to name a few. It's important that the leisure and health program is documented so that the participants are aware of the schedule and the duration of the program. and so that the facilitator can stick to what the program is. In the leisure and health industry, we come across a lot of paperwork. Why do you think it's necessary that we have all this paperwork and documentation? Well, let's take a moment now to look at some of the reasons. We need to meet the legislative requirements, such as the OH&S Act and the Aged Care Act. We need to record a client's progress, a client's abilities and their preferences. This can be documented on their care plan. We need to meet auditing requirements, such as during accreditation. Do you know what accreditation is? Have you heard of that term before? Accreditation is an internationally recognised evaluation process that's used to assess the quality of care and the services. This process is undertaken by the Australian Aged Care Quality Agency. Let's now look at the importance of recognising a client's complex needs when developing a leisure and health program. Many of our clients will have complex needs or comorbidities. A comorbidity is a generic term referring to the co-occurrence of disorders suffered by an individual. For example, a client could have a diagnosis of Parkinson's disease that impairs their physical ability, and also have a diagnosis of Alzheimer's disease that causes them to have memory loss. If you were developing a program for a client with Parkinson's disease and Alzheimer's disease, you would have to be aware of their abilities as well as their disabilities. So, it's important to have an understanding of the needs of your clients and to improve access of our clients with complex needs to leisure and health programs. Addressing support in leisure programs and daily activities is essential in maintaining the quality of life for your clients. Appropriate activity programs will help bring pleasure into our clients' lives, as well as foster their self-esteem and give them a sense of purpose and belonging. Let's look at some of the ways we can involve clients with complex needs into activities. First of all, we can foster links with local communities and organisations that share the same culture, language and religion of the client. We can facilitate family involvement within the activities. We can integrate activities with local community events. We can plan regular outings to places of significance that interest our clients. We can explore the availability of community volunteers to provide social visits to our clients. And we need to determine whether the client with complex needs can be integrated into mainstream leisure activities, or they may be better off experiencing one-on-one support. Our final topic in this session is the legal and safety requirements that relate to the leisure and health industry. To work effectively in leisure and health, you must ensure that all your work is consistent with the relevant legislation. In many situations, your responsibilities will be clear. However, there may be times when you need to seek a balance between your legal responsibilities and your ethical or moral requirements. For example, this may occur in situations where you believe your client is at risk of harm. In these situations, where you're unsure of your legal and ethical requirements, it's useful to discuss the problem with your supervisor or manager as soon as possible. In most organisations, there will also be protocols established to guide you through challenging or complex situations, which tell you what you should do, as well as who you should report to and how you should document your actions. Your legal responsibilities underpin the most of the work that you do within the leisure and health industry. Some legislation is relevant to all the services, and other legislation may be specific to a particular setting. For example, the disability or home and community care sectors. Leisure and health workers must understand the legislation that relates to their work, including which legislation supports particular areas of their practice and where to obtain further information about personal and organisational responsibilities under each legislation. Leisure and health workers, supervisors and organisations have a legal and ethical obligation to provide services according to the legislation and regulations, and to ensure staff abide by these regulations. These obligations exist to protect the rights of clients and people accessing the services. It is the responsibility of the organisation to ensure that its policies and procedures uphold the organisation's legal obligations. These policies determine the way in which daily activities within an organisation are delivered. Leisure and health workers must understand the statutory and legislative provisions that are relevant to their workplace. These are requirements that relate to particular laws at local, state, territory, or federal government levels. Some of the legislation and statutory provisions that impact on the leisure and health industry are the Privacy Act, the Aged Care Act, the Guardianship Board, Freedom of Information Act, the Disability Services Acts and Standards, Principles and Practices of Ethics and Values, Principles and Practices of Confidentiality, Principles and Practices of Duty of Care. Thank you for your participation in this webinar. Continue now by watching this video about a Seattle preschool that's set up inside an aged care facility. As you watch the video, think about the positive influences that children have on these residents, and also consider any work health and safety issues that would have had to be addressed prior to the preschool being set up within the aged care facility. Once you've completed this, continue on by doing your quiz and then your partial assessment. Thank you.